Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OET training. And I am Jawahar. Welcome back to Magical Session. Today we are going to discuss very important topic. Actually speaking, this is part 2. So we are discussing nursing theories part 1 as well as part 2. Part 1 video already streaming in YouTube channel. Those who never watched that video, please go and watch that first and then you can come back and watch this. Okay, so part 1 is streaming in the YouTube. And now we are going to discuss nursing theories part 2, important questions, answers, as well as the vital point related to that particular question answers. Okay, fine. So let's begin the session with your motivational thought. Failure or part of life. If you don't fail, you don't learn. If you don't learn, you will never change. First, we need to determine your goal. For achieving that particular goal, what steps you are keeping, that is very, very important. Definitely failures will be there. So many failures will be there. Without failure, you cannot reach your goal. You cannot reach the success. So many people will demotivate you. Okay, your friends, your colleagues, your family members, maybe they can demotivate you, but still your determination is strong means you can overcome all these barriers and you can reach the goal. Okay, so without failure, what is that? What is not there? Success is not there. Okay, fine. With this quote, let's move into the session. So as I mentioned already, we are discussing nursing theories, important MCQs, as well as the golden points related to that particular MCQs. And if you like the video, please like it, share it, and subscribe. And one more important thing I forgot to say, most of them has given the positive comment related to the discussions what we are doing in Magical Session. Thank you very much for that. Your motivation, your comments, your feedback will motivate us to post more and more videos. Okay, so thank you very much for that. And one more queries keep on coming to us, that is for CRE exam, common recruitment exam. It is going to be there on February last week. Is there any special crash course is running from Metier side? Yes, obviously it is there. So 35 days crash course, it is started. As early as possible, you can join us and please clear the session in the first attempt. Clear the exam in the first attempt. Okay, fine. For more details, the number it is mentioned down, that is 9600543642. It is there in the bottom. WhatsApp number is also there. Contact us so that we will approach you and we will tell the format, registration procedures, everything. Okay, so no need to worry about that. Join the course and clear the exams in the first attempt. Okay, fine. Let's move on to the session. First, I will be starting with the part 1 brief review. These things already there in the part 1. For detailed explanation, please watch the part 1 video which is streaming in the YouTube channel. I'm going to give now a brief review about the part 1. See, in part 1, firstly we discussed about Nightingale theory. Florence Nightingale theory, if it is there, this word is there in the exam means the highlighted points, all these highlighted points should come into your mind immediately. That is very, very important. All these points should come into your mind. Nightingale theory means immediately. It is an environmental theory. That is the first point. When it was developed in 1850, based upon Crimean War. Who is the founder of modern nursing? Florence Nightingale. What is the key concepts which is present in the environmental theory? That is, from the word itself, we can easily understood cleanliness, fresh air, clean water, hygiene, nutrition. Okay, so these points should immediately strike into your mind if you see the word Nightingale's theory or environmental theory. Okay, so not only this, the birth and death date are repeatedly asked questions. Okay, so please make sure you are writing each and everything in a separate register. Okay, the next important thing is Orum's theory. Here also, so many times they have asked the questions. Okay, so Orum's self-care deficit theory. Here, two main things are very important. Already we discussed in detail. The first one is concept and second one is where we need to practice the Orum's theory. The concept is very simple. I have mentioned here self-care requisite, self-care deficit and nursing system. For detailed explanation, please watch the part 1. Again, I'm saying. And Orum theory, where we can use it. We can use in the primary care as well as rehabilitation settings. Okay. And the next important thing is Paplow's theory. Very, very important theory, guys. From here, many number of times the question was asked. Okay. So here, Paplow's means interpersonal theory, interpersonal relationship theory. Okay, fine. So here the phases are very important. Phases you can see very clearly here: pre-interaction phase, introductory phase, working phase, and termination phase. 4 phase. In introductory phase, one important MCQ frequently asked in the exam: the discharge planning was scheduled in the introductory phase. Okay, the introductory phase also called as orientation phase. Okay, please register the Paplo's 4 phases of nurse-patient relationship, because the same question we are going to handle in part 2 session, that is now. Okay, after the part 1 review, we will be going to the part 2 session. There once again we will review these phases but in other names. Okay, because these 2 names are very, very important. Okay, fine. So pre-interaction, introduction, working, termination phase. So in working phase, 2 main MCQs are there. That is transference and counter-transference. Transference and counter-transference both will develop in the working phase. Transference means the patient feelings toward the healthcare workers, or counter-transference means the healthcare workers, they will be having a feeling toward the patient. Okay, fine. So this is all about the Paplo's interpersonal relationship. Apart from that, Medellin-Lininger theory, that is transcultural nursing theory. It was proposed by Medellin-Lininger. The year and what are all the things coming under transcultural nursing, everything I have mentioned in the part 1 video. Next, these are all few other highlighted things. 14 need theory, if the word comes in the exam, immediately you have to think about Henderson. Virginia Henderson. 21 nursing problem theory, immediately you have to think about Abdullah. King's theory means goal attainment. Always please keep in mind the full name of the author is very important. Okay, and Ida Jean Orlando theory means nursing process. In nursing process, as you all know, assessment, diagnosis, planning, implementation, evaluation, everything is coming under what? Nursing process theory, which is proposed by the Ida Jean Orlando. All these things we have covered very detailedly in part 1. Now it is the time to part 2. Let's start with the simple to complex questions. Okay, the simple question, repeatedly asked question, especially in ESI, RRB, these 2 exams is this one. Which of the following are component of paradigm of nursing? So in the exam, if you are getting the key point, paradigm of nursing, immediately you have to think about 4 concepts. How many concepts, guys? 4 concepts. What are the 4 concepts? You can see here. In these 4 options, they have given 4 concepts. But among these, which is the right answer? Paradigm of nursing, that word is coming in the exam means immediately you have to think about people or person. Okay, person, health, environment, nursing. Person, health, environment, nursing. These 4 are the paradigm of nursing. Okay, fine. How it is called as paradigm of nursing? All these 4 are related with each other. Let me tell you one thing. If there is a people or a person, his health is very important. So people and health, these 2 things covered. Okay, there is a person, his health is very important. If the health is deteriorated because of the environment, environment is the 3rd paradigm. Okay, immediately what is needed? Nursing care is needed. So if the person health is affected because of environment, nursing care is needed. So this is how you have to remember this theory. Okay, so which is the right answer here? Option D, that is person, health, environment, and nursing. Is that clear, guys? Yes. So here the nursing paradigm include 4 main concepts, as I mentioned already. That is person, health, environment, and nursing. So these are all the 4 meta paradigm. In the exam, they are asking paradigm, that is these 4 is the correct answer. If they are asking meta paradigm, that time also these 4, that is person, health, environment, nursing is the correct answer. Okay, guys, fine. So paradigm of nursing is over. 4 concept, remember. Okay, the next one is, it is a simple direct question, but very important. This question asked in the NORCET exams. Okay, the first nursing philosophy, underline the key point. Always remember the key point. First nursing philosophy. This is the first key point. Okay, on health maintenance and restoration. In the exam, if you are getting first nursing philosophy, health maintenance and restoration. Okay, these two key points are present means immediately you have to think about a person. Who is that person? Florence Nightingale. The Florence Nightingale, she said about the environment, that is cleanliness. Everything should be clean. Clean air, clean water, clean environment, hygiene, fresh air. She explained everything from the environment. It should be clean, right? At the same time, she said that health maintenance and restoration is very, very important. And this is the first philosophy, first nursing philosophy said by Florence Nightingale. So here it is a direct question and the right answer is going to be Florence Nightingale. Clear? Yes, two key points you have to get from this question. Okay. The next one is, which is the problem defining phase of interpersonal relationship as per Pavlov's theory? In a single reading, you should understand the question and you should grasp the key point, guys. This is the technique, strategy to solve the question. Okay, so in a single reading, I got 3 key points from this question. What are the 3 key points? The first one is problem defining phase. This is the first key point. Problem defining phase. Okay, next one is from which theory? Interpersonal relationship theory. Who proposed this? Pavlov's. Okay, so problem defining phase of interpersonal relationship theory proposed by the Pavlov's. Okay, so let's see the options. They're asking the problem defining phase. Problem defining phase. Already, I said that in the introduction of these slides, I said Pavlov's interpersonal relationship theory. The 4 phases are very important. The 4 phases, it is categorized into 2. Okay, so the first one is, let me show and explain so that it will be easy for you to understand. It will take some time. Yes. So this is the first 4 phases of nurse-patient relationship which is proposed by the Pavlov's. So what are all the pre-interaction, introductory, working phase and termination phase, and what are all the MCQ points which will be come from these 4 phases we already discussed. Okay, just now you remember these 4 phases. Now we can again go back to the questions. Okay, so in this question, what they are saying is problem defining phase of interpersonal relationship. Here also they are asking the phase, but here the names are different. What are all the names? Orientation, resolution, identification, and exploitation. But there what we studied, pre-interaction, introductory or identification phase, and working phase, and the termination phase. So these are all the 4 phases what we studied in that previous slide. But in this slide, the names are totally different. Orientation, resolution, identification, exploitation. So from among these 4 phases, in which ways you will see the problems, where the patient will explain the problem to you. This is the question. So here the right answer, as you all know, already it was mentioned here, in orientation phase, you are talking with the patient and now the patient is explaining their own problems to you. So here the right answer is going to be what? Orientation phase. Okay, the orientation phase is also called as what? Introductory phase. Orientation phase is also called as what? Introductory phase. In the exam, if they're asking orientation, you can go with the orientation. If they're asking introduction, you can go with the introduction phase. But the key point is problem defining phase. What is that? Problem defining phase. Okay, fine. So additional golden points you can see here, as I mentioned already, introductory phase, it is also called as orientation phase. Here, the patient will first discuss the nature of illness or nature of problem with the nurse. So orientation phase is over. Okay. The next one is identification phase. Already the patient explained the problem. Now, as a nursing officer, you are going to tell to the patient, you are having this many illness. And these are all the services we can provide to you to cure your disease. First, the patient is explaining the problem, that is orientation. Identification means the nurse is explaining to the patient, we are having this many services to cure your illness. You understand the identification phase? The next one is exploitation phase. So now, exploitation phase, you can compare with the working phase. Here, the nurse is working along with the team in order to cure the disease. The last one is resolution phase, that is a recovery phase or termination phase. Okay, so client is therapeutically treated and now the cure, that is, the patient is cured from the disease. Okay, so these are all the 4 phases. Okay, all these highlighted point. Orientation means what? Identification means what? So this concept, logic should come into your mind once you come across the Pavlov's theory. So 2 different types of phases: pre-introduction, introductory, working, and termination. Okay, and the next one is orientation, resolution, identification, exploitation. If they are asking anywhere in the exams, you have to answer. Okay, the next one is approach to health. Is that acknowledge and respect the interaction of persons, mind, body, and spirit. 3 key points: mind, body, and spirit. If these 3 key points are coming in the question, means immediately what answer should come into your mind? Holistic health model, clinical model, high level wellness model, health middle belief model. 4 options I have given here: mind, body, and spirit. If these 3 points, key points, are present in the question, means immediately you have to think about what? Holistic health model. What model? Holistic health model. Clear, guys? Yes. So these are all the key points. This key point will make you to get the answer easily. Okay. So mind, body, spirit means holistic health model. So who prepared or who proposed this holistic health model? Edelman and Mandel. So these are all the 2 persons who means created this holistic health model. Who is that? Edelman and Mandel. All the highlighted points are very important, guys. Okay, please make a note of it. Okay. The next important thing is Edelman and Mandel, they emphasize the connection between what? Between connection between mind, body, and spirit. Okay, so these are all the 3 key points you're supposed to keep in mind. Holistic health model means Edelman and Mandel. So what they have created, the connection between the mind, body, and spirit. That's it. Okay, so let's move on to the next question. The health, because in the previous question there was a option. One of the option is health belief model. So I added the question which is related to health belief model also. Okay, see, our focus is all the repeatedly asked question has to be delivered to the students, so that it will be easy for the students to clear the exam. That is our main motto. Okay, so that's why we are searching for the key points, searching for the repeatedly asked questions, and we are projecting to you. Okay, so health belief model was developed by, direct question. Okay, health belief model was developed by. So 4 options they have given here. Among these, the right answer is going to be option B, that is Rosenstock et al. Option B is the right one. Which is the right one? Option B is the right one. So let's see the golden points. Health belief model. If this word is coming, means the first thing what should strike in your mind is the name of the author. Already we know that Rosenstock et al. Actually, the full name should be very, very important. That is Irwin M. Rosenstock et al. In some examination, you know, they will not give Rosenstock et al. because it is a very familiar term. So they can give only Irwin. So that time also you're supposed to answer. Okay. So Irwin M. Rosenstock et al. Is a social psychologist. In 1950, he proposed health belief model. Okay. So 1950, social psychologist Irwin M. Rosenstock et al. Okay. These are all the first 3 golden points. Okay. Fine, guys. So health belief model. So you know about the author. When they propose this model, that also you know. But what this model says, that is the main concept of the theory, right? So this model states that health seeking and health avoiding behaviors. Okay, see, very important points. Everywhere I have highlighted, please make a note of it. Health seeking behavior and health avoiding behaviors. Okay, these 2 behavior is explained very clearly by Rosenstock et al. In health belief model. Clear, guys? Yes. The next important question is, the humanistic science of nursing was explained by. What is that? Humanistic science of nursing. Underline the key point, humanistic science of nursing. It is also called as science of unitary human being. Science of unitary human being. Okay. So these words are present in the exams, means immediately you have to think about Martha Rogers. So here the right answer is Rogers. Okay, you know about IDA. IDA means that nursing process, Nightingale environmental theory, Betty Lehman theory. We will be discussing next. Okay, that is system model. Fine. So here in the exam, if you found the word humanistic science of nursing, otherwise science of unitary human being. So these words are coming means immediately you have to think about what? Martha Rogers. Okay, sir. Martha Rogers, I got the point. What she says? She said about energy field. Each human being, they are having some special energy field that is connected with the environment. That is connected with the environment. Okay, so this is the major thing what they have said. See, actually in the exam, you can get the question like this also. What is the concept of Rogers theory? What is that? What is the main concept of Rogers theory? Just now I explained the main idea or concept of Rogers theory is each person has unique energy pattern. You can see here highlighted. Unique energy pattern that is connected with the environment. Clear? Yes. The next one is birth and death ceremony. May 12, 1914 is the birth ceremony. March 13, 1994 is the death ceremony. Nightingale's, Florence Nightingale's birth and death ceremony is very important. Okay, these birth and death ceremonies are not so much important, but that one is very, very important. Okay, fine. So now almost you have covered almost all the theories, and this last theory what I'm going to discuss now is very, very, very important. So many times asked in the exam, that is Betty Newman's system model. Here, three things you're supposed to focus, guys. If they are asking Betty Newman's system model in the exam means three very important things you're supposed to focus. Okay, so Betty Newman's means system model. That is the first one. Betty Newman's means what? System model. Okay, so here the individual, how they are interacting with the environment, that is explained by system model. So Betty Newman's means system model. That is the first thing you're supposed to keep in mind. Second thing, variables. What are all the variables present in the Betty Newman's? So this question also asked in the exams. Very simple. Variables means physiological, psychological, you can see here, physiological variables, psychological, socio-cultural, developmental, spiritual variables. So 1, 2, 3, 4, 5. 5 variables, it is explained by the Betty Newman's. Okay, Betty Newman's system model, 5 variables are there. That is physiological, psychological, social, cultural, developmental, and spiritual. That's it. So 2 vital points completed. System model, variables. One more is there, concept. Concept of Newman system model. This question also asked many times in the exams. If they are asking how many concepts are present in the Betty Newman, then you have to say 6 concepts are present in the Betty Newman. How many? 6 concepts. What are they? Client, variables, environmental, stressors, wellness, and nursing intervention. This question was asked in the RRB examination. Okay, so how many concepts are there? 6 concepts. So what are they? It is mentioned here. And about the variables, already I have explained here. 5 variables and 6 concepts. Okay, guys, fine. So the next one is stressors. See, in Betty Newman system model, they explained very clearly about the stressors. 3 stressors they have explained here. This is also very important. What are the 3 stressors? Intrapersonal stressors, interpersonal stressor, and extrapersonal stressors. So 3 stressors they are explained here. Okay, so intrapersonal means within ourselves. Tomorrow there is an exam. So because of that, so I am having some stress within me. Otherwise, I am having some illness. Okay, so I am having some kind of fever or something within my body. So internally, I am having some stress. That is called as what? Intrapersonal stressors. Interpersonal means between 2 persons. There is a problem. There is a conflict. That is called as what? Interpersonal stressors. Extrapersonal stressors means environmental factor. For example, there is a natural disasters, earthquake, flood. So because of that environment, there is some stressors affecting us. Okay, that is called as what? Extrapersonal. Other than person, some disasters is creating a stress. Okay, so intrapersonal, interpersonal, extrapersonal stressors. So 3 stressors are there. So on the whole, Betty Newman means it is a system model. You have to know about the variables. You should know about the concept, and last, you should know about the stressors. On the whole, most of the theories are covered. Important points, repeatedly asked questions are covered now. Okay, guys. Hope everyone understand the concept. So how was the session? Please comment the feedback in the comment section. Okay. And already I explained about CRE. If you are appearing for a common recruitment exam, you can join Metier Academy, and we are giving the 35 days short-term crash course. It will be so much useful for you for clearing the exam in the first attempt. Apart from that, in Delhi Saket branch, we are running evening batch for mainly targeting the NORCET 8. So if you want to attend that session, so the number is mentioned here. So you can just call to the number. That Metier Center, it is located just in front of the Max Hospital, Saket. It is very easy to reach that place. Okay, fine. So even in Pondicherry, the V14 bridge course is going on. Those who want to join offline or online session, they can come and approach the number which is mentioned here. Okay, so on the whole, for clearing the exams, Metier is always there for supporting you and giving the content. Okay, so it is up to you how to approach the exams. Okay, so all the best for your upcoming exams, and thank you very much. Let's wind up the session.